Hi, welcome to Stony Brook Medicine. I am Dr. Nicastri. I'm the Geriatric Fellowship Program Director at Stony Brook. I've been the Program Director since 2014. Prior to that, I was the Associate Program Director since 2003. I realize we have challenging times still continuing in front of us as you continue to have to make choices about your future without visiting the program or area. Please take some time to look at the video highlights that are on our website of the hospital and the beautiful North Shore of Long Island so we can convince you what a wonderful place Stony Brook is to work at. Stony Brook is centrally located and gives you the best of both worlds. We're just a very short train ride or a car ride from New York City, and we're also surrounded by wineries, farms, and a quick ferry ride to Connecticut and to New England. We're surrounded by beaches, trails, and small, unique seaside towns just within a few miles of the University Hospital, where you can actually visit wonderful restaurants and do some shopping while you're not working. There's a lot to do around us. We have a beautiful university campus within walking distance from the hospital with Division I sports, 3 art galleries on the university campus, performing art theater with international and nationally well-known productions to keep you occupied when you're practicing your excellent medicine here. Stony Brook University Hospital and Medical Center is an outstanding academic center. We're the largest academic teaching hospital on Long Island. We have over 624 beds. And we're the only hospital with a university right in our backyard with the campus within walking distance. Stony Brook Medical Center is the only tertiary care center in Suffolk County. Due to this, we have actually a very diverse patient population with complex comorbidities, illnesses, and challenges to learn from. We were named one of America's 100 best hospitals for clinical excellence by Health Grades, and we're recognized as one of the top 50 hospitals by U.S. News and World Report. As a fellow, you will spend time between multiple facilities to learn from. We have the Northport VA Medical Center, which is a federally funded VA. We have the Long Island State Vets Home, which is a state-funded nursing home. We have our wonderful primary care center, and we have 3 different palliative care and hospice settings that you can learn from. In addition, we also have a nursing home named Gerwin where you can do your subacute rehab rotation. We have a robust ambulatory geriatric clinical setting just 2 miles away from the hospital, which is a patient care medical home, and we have received the highest level of achievement. The NCQA gave us a level 3 certification for our patient-centered medical home. We have the highest concentration of geriatricians in one hospital on Long Island. We have 10 geriatric board-certified physicians in the outpatient, and we have over 5 inpatient geriatricians, and all of our nursing homes are filled with board-certified geriatricians. In addition, we have geriatricians working with us over in the VA too. Many faculty members who work with the fellows and teach the fellows have received clinical and academic teaching awards. The primary care center over at Belmead Road, which houses our geriatric clinic, offers comprehensive patient-centered care with a very supportive staff. The fellows have their own nurse and 2 secretaries to help coordinate the care of their patients. Our program coordinator for the fellowship, Catherine Mano, is also on site on scheduled clinic days for support. There is a social worker who works on the premises to help the fellows with their patients, and also we have 2 guided care nurses who help with coordinating care of our most vulnerable patients. Home visits is an integral part of our continuity clinic experience, and the fellows do at least 1 home visit a month for a day, and they can schedule others in between if there's a need for their patients. The fellows love these home visits, and it really helps improve care and understanding of what their patients need. And it really has always been a highlight for the fellows with the fellowship, and they really enjoy it. We have 2 continuity nursing homes that are part of the Fellows Experience, the Long Island State Vets Home and the VA Medical Center. In addition, we have the 3rd nursing home setting for subacute rehab. Additionally, we have 3 palliative care settings. We have an inpatient palliative care team that you'll work with for a month. We have a long-term care setting for palliative care, and we also have an inpatient hospice over at Good Shepherd, which is only 3 miles away. There's a variety of clinical rotations and settings that you'll learn geriatrics across the continuing spectrum of care, and you will be able to learn from a multitude of very complex patients. Stony Brook Geriatrics has 2 track options. We have a 1-year fellowship that has been accredited since 1991. In addition, we have a 2-year combined hospitalist and geriatric fellowship track that was established in 2015. Stony Brook was the first program to implement the 2-year combined fellowship track, and we continue to successfully graduate fellows every year from this program. The 2-year program splits your geriatric fellowship into 2 years, where you do 6 months as a fellow for the first year, and you combine that with 6 months as an attending hospitalist physician, and then the second year you complete your fellowship in 6 months, and you do another 6 months as a hospitalist. For those of you who are looking into becoming a hospitalist, or you need to earn more than a fellowship salary, this track gives you an edge. We also have a 1-year fellowship that's been accredited since 1991 when we started, and it's very comprehensive. The fellows leave getting ready to take the next step in their career and practice in a variety of different settings across the clinical spectrum of geriatric care. Many have worked as home care physicians, have worked in outpatient clinics, have even set up geriatric specialty clinics. Many work in nursing homes or even in the hospitalist setting. Our program offers fellows many opportunities to grow and network in the field of geriatrics, and they attend conferences annually, going to American Geriatric Society, going to the Palliative and Long-Term Care Society meetings, and they are members of the Metropolitan Area Geriatric Society. Many of our fellows attend these conferences every year and present their research and their posters. The number of geriatric patients is ever growing as the population is living longer than ever before, and there really is a need for skilled and qualified physicians to care for these patients. So I'm so happy that you're interviewing to do geriatrics. The opportunity in our field is limitless and endless, and Stony Brook will support you throughout all of your endeavors. We are a family here, and that's why I love Stony Brook, and I would love for you to be part of our family. I hope to meet you soon. Thank you.